So my first connection to HD was many years ago when I was working as a staff nurse in a neurology ward, and I had a patient who was in the very late stages of Huntington's disease, and both the patient and her family actually taught me quite a lot about the care, about communication, feeding, and from that point I think I've always had an interest in HD. I've been working as a genetic counsellor in Manchester for the last 20 years and more recently been part of the EHDM working group, Genetic Testing and Counselling, and I'm one of the co-leads for that working group. The guidelines are really there to kind of help explain what information and support should be available throughout the process. So that's before testing, having the test, and afterwards. So it's really to let clinicians know as well what's expected in terms of the information that they should let individuals and their family be aware of beforehand, and also to make it clear for family members as well. They can usually expect to have several appointments prior to having the blood sample taken. In some centres, that will be with a genetic counsellor and/or a clinical geneticist. In some centres, they may also see a neurologist to have a baseline neurological examination, but that's not essential for having a predictive test, so it's not inevitable that that would be part of the process. The very first time that you meet somebody at a genetic centre, it's very much a sort of conversation, exchanging information. So finding out about the history of Huntington's disease and getting enough information so that we can confirm the history. That's an important point still, so that we can make sure that we're testing for the right condition, because there are other conditions that are similar to Huntington's disease. So that would be often the first meeting's a very general discussion about HD and how it's inherited. That somebody may be very well informed about that part, but any gaps and some newer information we might discuss. The next appointment is usually much more about the pros and cons of testing. So thinking about things like to what extent they've talked with other people about having the test, if they're aware about possible issues of discrimination, if they're aware about the possible test outcomes. Years ago it would be a case of being gene positive or gene negative, but of course we know now about the possibility of getting a result, either an intermediate allele or reduced penetrance. So it's important that people are prepared for that and to find out what expectations they have of the test so that they're not disappointed, as it were, because a test doesn't remove all uncertainty. For example, if you're gene positive, we're still not able to say at what age or what stage the onset would be. And I guess another important part is really preparing for the results session itself and afterwards. So discussion about options for follow-up, options to participate in research, that should all be part of the process. So really what you're trying to make sure is that there's no regrets or no shocks or surprises later on in the process. I guess the importance of genetic counselling is really a little bit of rehearsal and possibly looking for any sort of gaps of information, and also to help with support and sort of guide people through the process. So what you'd hope is that in the process of genetic counselling, you would establish a relationship that people could contact you at any stage in the future if they've got more questions or if they're in need of support. So I guess it's really preparation for the test itself, preparation for what's going to happen afterwards. So in terms of thinking about support after the test, again, that's going to vary between countries, so I wouldn't want to be too prescriptive about it, but a very important part of predictive testing is that support should be available. The recommendations are that a genetic counsellor or somebody from the genetic centre should contact somebody a week or so after they've received the result. But I think it's a very reasonable question to actually ask at your genetic centre, if it's not been discussed, what support is going to be available to me. Within our own centre, most individuals like to be seen at least once a year. So coming maybe once a year for what is a sort of combined research clinic appointment or a clinic appointment alone if they choose not to participate in research. But it certainly should be discussed even prior to having the test, what the plan for follow-up should be.